We could not have coped with Tony's illness as well as we did had it not been for hospice. Hospice of the Piedmont will never know what impact they had on our family.
Hospice isn't a place, but a philosophy of care for dealing with a terminal illness to help make the most of every day. Once hospice care begins, the focus shifts from curing the illness to concentrating on the comfort of the patient. Since 1981, Hospice of the Piedmont has provided this compassionate care to thousands of patients with life-limiting illnesses.
Certainly one of the most challenging times in life is facing a serious illness. Our experienced team of professionals brings care and comfort to both the patient and their families at this critical time.
Serving 4 counties in central North Carolina, Guilford, Forsyth, Randolph, and Davidson, Hospice of the Piedmont serves the triad from a central office in High Point. This not-for-profit program provides palliative care, which means comfort care, and supportive services to patients and their families. Services are funded in part by Medicare, Medicaid, and some private insurance. Because of strong community support, no one is ever denied care because of inability to pay. Hospice care takes place in many settings: in the patient's home, in hospitals, in assisted living facilities, and in nursing homes, wherever the patient calls home, including Hospice of the Piedmont's 14-bed hospice home at High Point for patients with special needs in the last weeks of life. Hospice care is available for patients of all backgrounds, all diagnoses, all income levels, and all ages. Hospice care is coordinated care provided during the last stages of a serious illness, then during bereavement from a team of healthcare professionals, including physicians, registered nurses on call 24 hours a day, 7 days a week, medical social workers, nursing assistants, chaplains, bereavement counselors, and specially trained patient and family volunteers.
It's called an interdisciplinary care team. While we focus on the comfort of the patient from a medical standpoint, there is equally important emotional, social, and spiritual support for the patient and the family. Hospice, it's not about giving up. It is about adding quality to the days that remain.
For more than 30 years, Hospice of the Piedmont has helped thousands of families just like yours, caring for generations right here close to home. Many say they wish they had known about hospice sooner. The perception is that hospice care is reserved for the last few days of life, when in fact, hospice care can help the patient and the families for months, allowing the family to focus solely on sharing time with their loved one.
Until you need hospice, you close your ears to it. But when the time does come, it's a comfort knowing that your loved one is cared for by caring and compassionate people.
When is the right time for hospice care? If someone with a serious illness has troubling symptoms like uncontrolled pain, it's time to consider hospice care. Ask your physician or contact hospice directly for help. Hospice of the Piedmont helps patients find peace and comfort surrounded by those they love.